This is my persuasive speech.
And I'm her dad.
And I'm Gavin.
And my name is Michaela, and I'm a registered nurse who works in the intensive care unit at a level 2 trauma center. And today I'd like to persuade you about the verticalization bed and how it is able to aid in early recovery in patients who are critically ill and prevent complications associated with long-term hospital stay. So think about a patient who's closer to being dead than alive, but within a short period of time, they're back at home with their family and recovering there. It's hard to imagine that that's possible, but it is with the help of the verticalization bed. So I'd first like to go over what the verticalization bed is. But first, I'd like to preface that as an ICU nurse, I have witnessed this bed and the ability to help patients become more mobile at early stages that they normally wouldn't be able to do so in their healing journey. So first off, what is the verticalization bed? It's a specialty piece of equipment that gradually goes from a horizontal or position where the patient is lying down and take them gradually to a standing position or vertical while they're safely strapped in. This gives the brain the illusion that the patient is standing and allows them to feel the physiological benefits when really they're not doing any effort of their own. And Craig Therapeutics is a company that creates these beds, and they state that the patient is able to transfer weight to their feet, which activates muscles in their lower body and their core, which normally are not activated because they're usually just lying in a hospital bed. It also allows for lung expansion, which is also not usually possible while they're laying down. And getting that full lung expansion allows for a cardiopulmonary benefits along with just multi-organ improvements. So this bed plays a crucial role in the recovery of critically ill patients, but it's important to understand why early mobilization is important. And really, the risks of immobility have been studied for decades, and almost all studies show that prolonged immobility causes many adverse and serious complications, which could include things like pressure ulcers from being in a certain position for too long, ICU delirium from being in the hospital for too long, thromboembolic events from not getting your blood up and moving. It can cause it to clot. Ventilator-acquired pneumonia from being on a breathing tube, which is a tube that goes into your throat and into your lungs, and bacteria can form if that's in for too long, as well as many other things. And the NIH recognized the importance of early mobilization in a progress journal done by Amal Singham, where he emphasized that getting patients up and moving earlier mitigates the risks of adverse events, as well as decreasing the psychological distress associated with not being mobile. So even though patients face physiological effects of not being mobile, they're also experiencing psychological effects. So trying to get patients up and moving earlier can help mitigate and treat both of these issues. So given the benefits of early mobilization, you may wonder what type of patients may benefit from the use of the verticalization bed. And really, this is a very broad answer because so many patients with different physiological problems can benefit from the use of the verticalization bed. One that I have witnessed is patients receiving that mechanical ventilation or the breathing tube that goes in the mouth and into the lungs. And when they're on this tube or on mechanical ventilation, they require sedative medications to keep them sleepy, which also is helping them recover. However, they're not able to participate in active physical therapy. So using the verticalization bed can substitute that therapy and get them involved in both of that. So that's just one thing. There's others like patients who have ICU weakness and muscle atrophy from just being in a bed for too long, as well as elderly patients who are prone to falling or are just prone to deconditioning due to the increase in age, as well as respiratory issues like pneumonia or COPD. Getting them in the verticalization bed can help with the lung expansion. Maybe neuro patients who had spinal cord surgery or had a stroke or a traumatic brain injury, the bed can help reintroduce them gradually to an upright position. And that's just many of the different types of patients who may benefit. But another thing is, are the beds cost effective? And despite these beds having a very high upfront expense because they are such a technological piece of equipment, due to their ability to speed up recovery and the long-term healthcare expenses are then reduced, as the hospitals say, is just overall shorter. So in an article done by Joseph Dasta on the critical care med, he discussed that the most expensive days in the hospital are usually the first 2 days of admission. And thus, if the verticalization bed was started and used early in the process, that recovery process is then kickstarted and the patient isn't going to be in the hospital for as long of a period of time. So overall, the verticalization bed is a therapeutic tool that is used in healthcare to prevent adverse outcomes and speed up the recovery of patients who are critically ill. And today I discussed patients who may benefit from the use of these beds and how the bed works, as well as how often they're being put into the healthcare today. So I hope I persuaded you on the verticalization beds, and I thank you for listening. Do the audience have any questions? Dad, do you have any questions?
No.
Thank you.